Hello, in this video we'll discuss about the intercoastal space and its contents. So as the name suggests, intercoastal space is the space between the two adjacent ribs. This space contains intercoastal artery, intercoastal muscle, intercoastal artery, intercoastal vein, and intercoastal nerve. We will discuss about each of these contents in this video. So first, let's start with the muscles. Intercostal muscles are of three types. The name of the muscles are external intercostal muscle, internal intercostal muscle, and innermost intercostal muscle. The origin and insertion is each external intercostal muscles, internal intercostal muscle, and innermost intercostal muscle originate from the lower border of upper lip and they insert on upper border of lower lip. So the direction of these muscles is as shown in the figure. This is the external intercostal muscles fibers. So these fibers, they are directed medially downwards and forward. On the other hand, the fibers of internal intercostal muscle and innermost intercostal muscles are directed laterally, backwards, and downwards. So, the nervovascular structures, that means the veins and the arteries, is present between the innermost intercostal muscle and internal intercostal muscle. The nervovascular structures are present between the internal intercostal muscle and the innermost intercostal muscle. So what are the action of these muscles? These muscles basically support respiration. So with this reference, we'll discuss about the muscles of respiration. So muscles of inspiration, basically there are two muscles, external intercostal muscle and the diaphragm. The accessory muscles are scalene muscle, sternocleidomastoid, serratus anterior, then erector spinae, and the pectoralis major and minor muscles. Similarly, muscles of expiration are internal intercostal muscle, innermost intercostal muscle, and the accessory muscles are transverse thoracic, sternocostalis, and subcostalis. So this is about the intercostal muscles. Now we'll discuss about the intercostal artery. Intercostal arteries are of two types: anterior intercostal artery and posterior intercostal arteries. So first we'll discuss about the anterior intercostal artery. Each of the space contains two anterior intercostal arteries, but they are absent in 10th and 11th spaces. So the anterior intercostal artery, they supply the anterior aspect of the intercostal spaces. Each intercostal space contains two anterior intercostal artery, but anterior intercostal arteries are present in 11th and 10th intercostal space. So let's see in the figure. This is subclavian vein, subclavian artery. This is internal thoracic artery, which is the branch of first part of subclavian artery. This internal thoracic artery gives two branches in each intercostal space. So this is the first step and this is first intercostal space. It gives two branches in first intercostal space, second, third, fourth, fifth, even in sixth. But in the sixth intercostal space, this internal thoracic artery gives two branches: superior epigastric artery and the musculophrenic artery. And this musculophrenic artery supplies 7th, 8th, and 9th intercostal spaces. Along with these intercostal arteries, there are several perforating branches of internal thoracic artery. Among these perforating branches, the second perforating branch, third and fourth perforating branch in case of female, they supply mammary glands. So this is about the anterior intercostal artery. Now we'll discuss about the posterior intercostal artery. On the posterior side of the intercostal spaces, unlike the anterior side, there is a single artery supplying each of the intercostal spaces. So this is the subclavian artery. Subclavian artery gives a branch called costocervical trunk. This is the branch of second part of subclavian artery. This costocervical trunk gives a branch called superior intercostal artery. This superior intercostal artery gives two branches which supply the first and the second intercostal spaces. For rest of the spaces, the branches are arise from the descending thoracic aorta. So these branches supply each of the intercostal space. So in case of 10th and 11th intercostal spaces, there is a single artery which supply these spaces, which is the posterior 10th and 11th posterior intercostal artery. Now let's discuss about the venous drainage. So similar to the intercostal arteries, there are also intercostal veins. Anterior and posterior. So the anterior intercostal veins draining anterior side and posterior intercostal vein draining the posterior side. Anterior intercostal veins, they accompany anterior intercostal artery. That means the first to 6 intercostal veins drain into internal thoracic artery. And 7, 8, 9, these veins, they drain into musculophrenic artery. In case of posterior side, this is the not the same case. They do not accompany the posterior intercostal artery, but the venous drainage is such. This is the superior vena cava and this one is the inferior vena cava. This is right side and this is left. This is left brachiocephalic vein and this is the right brachiocephalic vein. On the right side, the first intercostal vein drains directly into the right brachiocephalic vein. The first intercostal vein directly drains into right brachiocephalic vein. The second, third and fourth intercostal vein, they form right superior intercostal vein which drains into the azygous vein. So this is the azygous vein. Second, third, fourth, they form right superior intercostal vein which drains into azygous vein. Then the remaining intercostal veins, 5th, 6th, 7th, 8th, 9th, 10th and 11th, these veins directly drain into the azygous vein. On the left side, this is the first left intercostal vein. This drains into left brachiocephalic vein. The second, third and fourth, they form left superior intercostal vein Second, third, fourth, they form left superior intercostal vein, which drains again into the left brachiocephalic vein. Fifth, sixth, seventh, eighth, they form accessory hemiazygous vein, which drains into the azygous vein at the level of T7. And the 9, 10, 11th, these veins, they form hemiazygous vein, which drains into the azygous vein at the level of T8. So this is the posterior venous drainage. Now we'll see about intercostal nerves. Intercostal nerves are nothing but the ventral rami of thoracic spinal nerve. The third to sixth intercostal nerves are known as typical nerves since they supply only thorax. The first nerve, we know C8 plus T1, they form the lower trunk. Of brachial plexus, which supply the upper limb. The second nerve is intercostal brachial nerve, is known as intercostal brachial nerve. The 7 to 12th nerve, they are supplying the anterior abdominal wall. Hence, the third to sixth nerves are known as typical and the rest are not. Now we'll discuss about the applied part of intercostal spaces. The study of intercostal space is important in pleural tapping. Pleural tapping is done in 7, 8 and 9 intercostal space. It is done on upper border of the lower rib. This is because the lower border has structures such as intercostal artery, intercostal vein and nerve. So this is done on upper border of lower rib. It is done in the mid-axillary line. The structures pierced during pleural tapping are first is skin, then superficial fascia and deep fascia, Then comes muscle, serratus anterior. Then external intercostal muscle, internal intercostal muscle, innermost intercostal muscle, then endothoracic fascia, then comes pleura, the parietal layer of pleura. Remember, the parietal layer is pierced and not the visceral layer of the pleura. So this is all about the intercostal spaces and its content. Thanks for watching.